So you're wondering if you're gonna scar after the labiaplasty procedure? Well, there are two kinds of labiaplasties, right? We do labia minoroplasty, which are the inner lips, and or labia majoroplasty, which are the outer lips. Now, there is a difference in the skin type for both. The labia minoras are we call non-keratinized. This means the skin is very smooth, thin, shiny, and well moisturized. It's just like the inside of your mouth. So with that kind of a skin which doesn't have a keratin much, it heals without any scar tissue. You won't find any scar tissue inside of your mouth, would you? Same thing up here. It's extremely rare for the labia minoroplasty to scar, especially when the incisions are more on the inside. We have our incision either on the inside or into that groove between the labia minora, which is the inside, and a labia majora, which is the outside. Now, labia majora skin is a little different. It is the hair-bearing area of the labia, and it is a keratinized skin. So there is a slight risk of having a scar tissue in that area. So what I also do is that my incision are also into that sulcus or a groove which is between the labia minora and a majora. So they're kind of hidden, and that area usually does not form any scar tissue. Now, if the stitches open up, there's an infection or any kind of a complication which is going to cause the widening of the scar, it can scar. Or if there are people who have a tendency to get the keloid or a scar, they have that slight risk of scarring. So for those patients, we take an extra step. We make sure there's not much tension on the incision. We give them special kind of cream which has got silicone and copper in it, which helps with the healing. So is there scarring after that? Very possible, but very small percentage of people for labia majoroplasty.